Welcome to the West Yorkshire Dental Implant Centre. I'm Kate Hardcastle and I'm here to talk to the team today so they can tell me a little bit more about the process that is dental implants. I think a lot of people hear the word implant and associate it with something quite alien. Maybe they might have seen some extreme versions of cosmetic dentistry. But let me just understand that process. Why is that process important for patients? How can it help patients that have missing teeth, for instance?
An implant is just a medical grade titanium screw. It goes into the bone, it becomes part of the body. At that point, we then have options of what to do with that. My background is very much restorative driven. My MSc was in crowns and bridge work and how to make that patient's mouth function correctly. Implants to sort of fit into it. So I'm looking at it from a point of view as how is that patient going to walk out of here happy, and that doesn't mean they're going to have a whitewashed set of teeth. Most patients just want things to work. They want it to look nice and they want it to be them. So that's what I think is the skill, and that's why people come here, because they want to be treated like an individual.
Paul, you work very much with implants and the implant placement process. Can you explain to me how does that work and what benefit can that give a customer?
The patients come to me when they've had their implants placed, and simplistically they've got some little coverings that are poking through the gum. We check that everything is settling well. We remove those coverings and take scans of their mouths. We send those off to the lab, and then 2 weeks later we screw into the implants the new teeth. A lot of patients come in with missing teeth, especially at the front, and they'll be covering their mouth when they speak to you because they're shy, they're embarrassed, and I think it does have a massive influence on your confidence. So to be able to give people fixed teeth which are restoring their smile, their confidence, it's a fantastic job to do. Patients are happy, and it's a real feel-good treatment to do.
So Nick, tell me what you do here specifically.
So I come here to place and restore some of the implants. I've got a master's degree in implantology and oral surgery from a university over in Italy, and basically that allows me to do the pretty complicated stuff.
And what difference have you seen it make for people?
As I say, absolutely life-changing. People who subconsciously don't smile, people who don't go out for dinner or don't go meet their friends because they have dentures that fall out. So having that's now changed so they can do that is quite literally life-changing.
Brian, you've been a patient here for about 5 years.
5 years.
Talk to us about the journey you've been on.
It started with a recommendation from my own dentist. There was a couple of teeth at the back that were beyond repair. They came out, and obviously you look at the alternatives, and then it was a case of a recommendation to come here to have a conversation initially about my needs and about what I wanted, which I found very, very valuable. For me, it just wasn't teeth. It was about the jaw graft that I had. My breathing certainly better since I've had a look at what was happening to my jaw, and then absolutely no issues at all with the implants. It's a pleasure to come, and hopefully it doesn't have to be a continual process too quickly because the rest of my teeth are quite healthy. If that's not the case, I'd certainly come back.